I have been an apostle of finding a solution to this in Africa, just to help our women. So, you will see that infertility is a problem that affects many people. And they believe that without having children, their lot is gone. They have no solution. And there are subsequent problems that follow this. You will see that in many cultures, childless women, they suffer discrimination, stigma, they are ostracized, they are not part of the society. The sense of lawlessness, and many of them, as you've seen, are banned from even attending any meetings. Family meetings, they have no say. Relations of these people, they have the same problem, that the sense of belonging is no longer there. And the global picture says that there is disrespect. In fact, the younger woman that has a child, the older woman now will have to start to worship the children of this younger one. And that is the level of disregard that they give to this. You've talked about the story of Uganda and so many other cases. Now, you can now see so many broad perspectives of this problem, that it is a situation that continues, and WHO has now taken a cue from United Nations that infertility is a human rights issue. That is, every human being, male or female, has the right to have a child. And as a result of this, we must, all stakeholders, the professionals, the health ministries, the pharmaceutical industries, must come together to address this issue. And that is why the campaign by Merck is a very, very admirable one. And I think Merck Pharmaceutical deserves a big round of applause from all of us for this effort. Because this issue is more than a woman. It requires a lot from all of us to help these people to achieve what they want. Seeing a pregnant woman and thinking, when is yours coming? So we must change the mindset. Words matter. And the minute we begin to tell our people that infertility is not a cause, it's not witchcraft, it's not from the native medicine, it's not the sins of our forefathers. It is a reality. It's like headache, it's like diabetes. So, and it can be resolved. There are solutions to it. So, we need to stop it. We need to stop infertility in a comprehensive manner by starting like this town hall meeting and expanding it and carrying the message worldwide. I'll give you the example in Nigeria. Stigmatization, it goes through every aspect of life. The socioeconomic well-being of the couple is affected. And more so, you could see that it extends to the wider family, and the guilt and shame. I've seen parents come to my office, to my clinic, doing all they can so that their daughter can have a baby, a child in her marriage, ready to spend everything and looking so guilty as if they did something, whereas it's no fault of theirs. So we need to do something. It's no longer that we have to put so much emphasis on this global acceptance that before a woman can be accepted, she must have a child. There is more to womanhood. Being a woman in creation has more role than being a mother, because womanhood is the ultimate to spirituality, and not having a child, you can still have a role to play in the world. However, despite that, I must say that, for example, in Lagos or in Nigeria, when you do not have a child, the husband continues to marry and is given rights for polygamy. In some cases, the woman is given to another brother to help. So they've devised means in those days, because we recognize the fact that infertility occurs in 40% due to male. But the male couples have developed this method that when they cannot do it, even though the blame is on the woman, but they transfer the woman to another man to help to carry out the process of conception. And it's well accepted in the African environment. And the woman has to suffer that situation. How can we intervene? First of all, the first line level of intervention is education, education, education. Education must start from the beginning. We must let our people know, my pet program now, that diet and the environment, they are producing a lot of toxins that can create infertility. We have people who eat stockfish with heavy mercury. The environment we live today is more toxic than the one our parents lived in, our forefathers. And the truth from the biblical way was that you should reproduce with ease. You should have conception with ease. But we violated this. We started eating wrongly, bad food, and we also have done technological development. Pesticides, X-rays, and all these things are having effect on the sperm, killing the sperm. And of course, multiple intercourse, sexual relationship, unprotected, infection. I always tell people that I talk to in secondary schools that the first sign of infection is not the discharge, it's pain. So once there is pain, then you need to see a doctor. Don't wait for the discharge, because early diagnosis, early treatment will prevent the blocked tubes or the damaged sperm cells. And another one that is very common, which is not known, mumps will cause permanent testicular damage, mumps or otitis. So once you are pregnant, make sure your boy or your young one do not go and visit somebody that has mumps infection, because if she gets infected, then that is the end. We've got other things. We have oocyte and egg freezing, surrogacy. Assisted reproductive technology have come to the aid of women. It is now important that we in Africa take ourselves as a global region and assist each other where these facilities are, so they can have that attempt to go there, so that, because we can identify with each other better than we would do if we were going to London or to America, and so the empathy is not that much there. We have so many policies that that government can do to facilitate the proliferation of assisted reproductive technology. We can have exchange of faculties in our capacity building. I also say that the intervention cannot be one way. It has to be holistic, starting from the community, educating the community, from school, the problems of infection, the dangers for it, and the use of protected intercourse, using condom, and then taking it, early diagnosis, early recognition of problem, and then when you have it, you treat it. And so many things have been done in that level. I would say that the lifestyle is important. Eat well, eat right. Too much of sugar can lead to diabetes, which can lead to infertility problems, and so many other things like that. And then we need to take care of our newborn and look for them. Low income is a problem. So in Nigeria, we now have sponsorship. Foundations give help to infertility couples. In fact, infertility centers are being encouraged for every 10 cases to take one as a special case that they can give at low rate. These are things that can come even from the practitioners themselves. There need to be increase in private centers that can handle infertility. I hear that there are 5 centers in Uganda. There are many ways you can multiply that process. You can have a central command, and you can have satellite centers that can also help in doing this. And then one man can help in proliferation this. I will go through this rapidly about the toxins in the environment, transmitted diseases, and just to introduce to you the assisted reproductive technology, which started because of the work of Steptoe and Edwards in 1976 in London. They had the first test tube baby, and then it progressed there until we were able to have the same thing in '84 in Africa, in Nigeria. And we've also extended this to pre-implantation genetic diagnosis, because many families suffer when they have no boy in their family. They can't inherit any family. So we address this by being able to select the sex of the husband, of the baby. And we've also used this for sickle cell diseases, because AS couple, when they marry, they get to prevent sickle cell. So we use this method to isolate it. And we can select a male child on the left and a female child. We can select those embryos and transfer them into the patient. So we've done so many cases, over 75 cases so far, and these are the results we have. They're very encouraging. We've had significant success. Many babies born. People who want female child, we've been able to help them, and those who want male, we've been able to help them. And those who want sickle cell separation, we've been able to do so. And lastly, to say that we've helped couples in Nigeria and in Africa. People are coming from all over the world to our center. And the driving force for you to care for infertility is that you must recognize no superiority in mankind other than goodness. Because if we all aspire to be good, this world will be a good place for all of us. Thank you.